Zoom and recording on the cloud. And over to you, Rajat, if you would like to begin your presentation.
Okay, can you all see my screen?
Yes, we can see that.
Okay, and I'm just going to try moving the slide. Can you see the slide change?
Yes, that's fine.
Okay, good. Thank you. Thanks, Adrian, and welcome everybody to the session. So I'm going to share our findings from this online survey that we conducted in India post COVID-19 lockdown. This is the first wave that happened last year. We looked at residential electricity use and thermal comfort and well-being of residents during the first wave. I'll talk briefly about the rationale for the study, go into the aims, what methods we chose, and then focus really on findings and conclusions. There's a whole paper on this, so if there are any queries, please let me know. So really the project came about because we were doing an ongoing study in India. This has been over 5 years, looking at residential building energy demand. And to be honest, the fieldwork had stalled that time because COVID had struck. So we thought, let us move to online surveys and actually see what is happening in India, post lockdown. As we know, in March 2020, COVID-19 was declared a global pandemic by WHO, and India went into complete lockdown on 25th March 2020. This is the first wave. Just to stress, I'm focusing on the first wave. As we know, there was a more deadly wave earlier this year. That is not the focus of this paper. I'm focusing on the first wave, which was last year. And as we know, during the pandemic, it's an interesting period because it's a period of stress, really. Offices and schools are shut, homeschooling and home working happens, and that's happening globally. So it's interesting to see, what happens to residential electricity use as more people spend, time at home. How does it affect well-being? Does the sense of community increase? And what appliances get used more, and what's the effect of AC usage? So there are some studies now investigating the impact of COVID-19 on residential electricity demand, but they are quite limited in India. And we feel this is one of those studies that has contributed to that knowledge. So our aim was to empirically investigate the impact of lockdown on change in residential electricity consumption, both across the mix of air-conditioned and non-air conditioned homes. Any change in usage patterns of air conditioning, whether desert coolers were used or other cooling devices were used. The well-being of residents, the utilization of spaces, what rooms started to be used more, and what was the perceived thermal comfort. So we gathered data using an online survey. This was done during May and June 2020, and we considered the before lockdown period as February 2020, so just before the lockdown happened, and the during lockdown as April 2020. The reason being that some of the lockdown measures had started to ease in India from the beginning of May 2020. So we felt that these 2 months gave us those clear kind of time periods for before and during lockdown. The study, as I said, is part of a wider Indo-UK research program that I'm leading on RECITE, which is on residential building energy demand reduction. I've given the link to the website. I expect the slides will be shared, so you can kind of find that link. The questionnaire survey was obviously online using Google Forms. And we focused on dwelling attributes, what kind of house it was or apartment, socio-demographics of people. What was their perception of the community? Because that's kind of, affected during lockdown. The usage of appliances, especially ACs, desert coolers, thermal sensation, thermal preference, and electricity consumption. So we did ask the respondents to give us data on electricity use by uploading fuel bills. So not just inputting the data, but actually providing the fuel bill. So the data that we analyzed is being shown based on actual measured data. And then we had, it was based on random sampling, and our responses were from 4 climatic zones, which really cover the geography of India: composite, warm, humid, hot, dry, and cold. And there were 360 responses. You can see the split here. It's heavy towards warm, humid, and composite. And then a subset of those 88 households were really where we had the split again between warm, humid, and composite. And these 88 households provided us the electricity data. So the 360 household sample represented about 1,500 occupants, in terms of the households. About 57% were apartments. 36% were in high-rise apartments, and the remaining in less than 4 stories, and then 43% were in houses. So out of which 24% were row houses, the remaining were standalone houses. And 44% of respondents worked in the service sector, so they were really affected and they were really working from home. And 67% of respondents were in the age group 18 to 13, and 21% were in the age group 31 to 50. So really the kind of working population of India. Median number of occupants were, per household was around 4. And you can see the distribution of our survey coverage here. It did cover in almost the entire country. You can see that there's quite a big coverage in areas where there was, quite a large number of COVID cases, and then spread across the country. So we were confident that, although it's not obviously statistically representative, but it gives a strong indication of the trends in India at that time. So I'll go on to findings now. I think I want to focus a little bit on sense of community. We asked them about in the questions about, about whether they were stressed out, which obviously, quite a few said they were. But the sense of community we found had increased during the lockdown, especially for residents in high-rise apartments, followed by apartments, below 4 stories. This was lower amongst occupants in houses. This could probably be because, these were probably villa-type houses, and they were not, close to each other, and they were not sharing communal spaces, probably, which is probably more in apartments. About 42% of respondents also felt an improvement in support from neighbors, local groups, and services during the lockdown. And this again was more higher in respondents living in apartments than those, inhabiting standalone houses. We also asked them about the perception of thermal comfort. We asked them about thermal sensation and thermal preference. In AC households, the perceived indoor temperature was, neutral to warm here, and the preference was to be cooler. Just to remind the audience that the survey was done in May, June 2020, which is, the kind of cooling season in India. So it was pretty hot that time. So this wasn't unsurprising that, people were feeling warm and they wanted to be cooled. And similar things we found across the non-AC households as well. Just to be clear, AC households in India does not mean that the air conditioning is on all the time. It might be that at that time, even in AC households, air conditioning was not being used. Because also the advisory from the government was, not to delay the use of air conditioning. We also asked them about indoor air movement, and it was, really, found to be either neither high nor low, or slightly low, and the preference was, to have a bit more, which is also unsurprising given the time of the year. We also asked them about space utilization, because we wanted to see, what adaptation was happening in homes. It was clear that, the number of hours at home of working had doubled, obviously, or tripled, in some cases. In non-AC households, 57% of residents occupied a different room, both during the week and the weekend, and they could be other spaces like the living room or the dining room or the kitchen areas to do their work. This was much restricted in AC households, where occupancy of bedrooms had increased, possibly because the bedroom had air conditioners. So we can see that the non-AC households actually offered a bit more adaptation and a bit more variety to people to work at in different areas, whereas this was much restricted in homes with ACs. Then we asked them about usage of appliances, and the respondents from composite and hot dry climates used air conditioning the most during the summer period, as expected. And across the climatic zone, in the composite climate zone, it was a 40% increase, and it was a bit lower in the hot dry and the warm humid climates. The washing machine refrigerator had similar usage hours before and during lockdown. This is obvious because the refrigerator is always on and people are still washing clothes. We suspect what has happened is the timing of washing machine has changed because people were at home, so they could utilize the outdoor weather for drying clothes, which is also an interesting find in terms of home working and its implication for usage, for the timing of energy demand. In AC households, overall usage increased by about 60% in desert coolers. There was a definitely increase in laptop and desktop computers, so ICT and utilization of TV as well. And obviously non-AC households with absence of air conditioning, the increase was higher in the desert coolers. Then going on to electricity use, this is as I said, from measured data, validated through fuel bills. What is interesting is if you look at the sample of AC, non-AC households in the 360, the AC households really use double the amount of electricity, almost, as compared to the non-AC households. And you can see, even the cost is, more than double over the mean monthly electricity consumption. And you can see, the difference between those who have ACs and those who don't. As we, after weather correction, we found, over the months of February, March, and April last year, there was an increase of about just over 30% in mean daily electricity use, as compared to during lockdown and, before lockdown. So before lockdown, it was around 8 kilowatt hours per day, which went to, just over 10.5 kilowatt hours in April. So there was definitely an increase. And we did account for the warm weather. So this is including weather correction. Even after that, there was an increase. The survey results, so we have some measured data. We were also, of course, asking about usage of appliances. And that showed that 69% of the respondents in AC households and 21% non-AC households perceived the electricity consumption had increased. And you can see this before and during lockdown. But just to stress that the magnitude of the rise in electricity use was much lower in non-AC households as compared to AC households, which had a 44% increase against a 9%. And between the climatic zones, hot, dry regions saw a rise in AC households, and it was the warm, humid region where there was a rise in electricity use for non-AC households. So what do we conclude from all this kind of empirical data analysis? I'll give you some takeaways before I end. One, definitely the residential electricity use has increased in our sample of Indian dwellings by about 30% during the lockdown period. And that was obviously driven by home working, homeschooling, and also the warm weather. These findings actually concur with other studies. Another study was conducted to look at residential electricity use during lockdown in India, and that's predicted 24 to 35% increase. So we are well within that. The mean monthly electricity consumption in AC households was found to be double that of non-AC households, obviously because there was a 30% increase in AC usage hours. And that's interesting because you can see, what air conditioning can do to the electricity use of a household. And the rise, as I said, electricity use was most in composite and hot, dry regions. That was because of course, the extreme conditions that occur. And in non-AC household, the increase was happening in warm, humid regions where there was increased use of ceiling fans, TVs. Most of the respondents, from whether they were with and without air conditioners, they perceived thermal sensation to be on the warm side and preferred to be a bit cooler. And as I said, there was an improvement in support from neighborhoods. About 42% homes did report that, and it was higher in apartment blocks, clearly, because of the proximity, I think, of households and the communal areas being used common. But I think the key implication of this is, home working and homeschooling, it's still prevalent in India. It's not ended, and like in many parts of the world. And as this continues through the pandemic, the policymakers need to be worried because, you need to curtail the rise of residential electricity use. And that probably needs urgent attention from policymakers because it could change the demand profiles as people continue to work from home and school from home. I think I'm going to stop here. I've also probably run out of time. Thank you very much.
Okay, thank you very much, Rajat.
Thank you.
Very close to the time. I can see my co-host Abdullah has arrived. I don't know if you'd like to say something.
Thank you, Dr. Raza. Actually, do you have any question from any others, or we will go for the question and answer session at the end of the?
I think yes. If anybody's got any questions, could they put them in the chat box? I can see Sue Roth has put some in the Q&A, but maybe if we just concentrate on the chat, then we can get all of them in the same place. So I think since we're more or less on time, we could move on to the second presenter, Nora. If you'd like to make a start with your presentation, share the screen.
Sure. Good afternoon, everyone.
Good afternoon.
Can you see the screen?
Yes. Can you make the screen?
Sure. So my name is Noura Al-Hinai. I'm a sustainability engineer at a local consulting firm in Muscat. On behalf of my group and I'll be presenting the study of the influence of buildings' architectural features on thermal comfort during the lockdown period in Saudi Arabia. And this is in association with the University of Ta'if in Saudi Arabia. So I'll take you through the presentation. First, we'll look at the background and key issues of pandemics. The lockdown focus area is Saudi Arabia. We'll look at the climate analysis of representative cities, thermal comfort and buildings, the residential buildings in Saudi Arabia, and how the situation was like under COVID, the aim of the study, methodology, and we'll look at the preliminary results and the next step. So historically speaking, pandemics have been increased by the likelihood of increasing human populations and the evolution of civilization and rapid urbanization. So early examples include leprosy, Black Death. There have been 7 cholera pandemics, as well as SARS and obviously COVID. Impacts of COVID were devastating, and we are still suffering from its aftermath. It has led to a substantial loss of human life. So up to now, around 5 million deaths, unprecedented challenges in public health, economic crisis, including the shocking blow to the oil and gas industry, trade restrictions, and has threatened food security and people's livelihoods. So we'll look at Saudi Arabia. It is the biggest country in the Middle East and occupies 80% of the Arabian Peninsula. Most of Saudi Arabia falls under the hot dry zone, whereas hot humid climate is present around the coastal areas, and the highlands or high altitudes is a small mountainous area in the southwest where the climate is moderate and not as extreme compared to the rest of the country. Riyadh is representative of a hot dry climate. The air temperatures are uncomfortably high most of the year round due to the sky index, which is clear. It correlates with the low rainfall of 100 millimeters per year. Hot humid climate is Jeddah. It is located around the coast in the northeast region of Saudi Arabia. It is a port city and rainfall is also minimal. However, there's high humidity levels and as well low rainfalls throughout the year. Abha is a high altitude city. It is located southwest of Saudi Arabia. The climate is not as extreme as Riyadh or Jeddah, but it's classified as semi-arid, and it's influenced by its high location at a high elevation. The sky coverage is around 20 to 40%, and it receives an average rainfall of 300 millimeters per year. The aim of providing thermal comfort in buildings has been a primary concern in architectural design. The building envelope is the primary force of indoor climate modification and thermal comfort. External parameters such as building form, orientation, and position affect different parts of the facade. Internal conditions such as building use and occupancy patterns influence the overall comfort levels inside the building. Comfort levels are defined by both psychological and physical aspects of the human mind and body. Designs that do not regard thermal comfort, oral comfort, visual comfort, and air quality may result in issues ranging from momentarily discomfort to chronic illnesses. Higher energy requirements of a building are mostly related to heating or cooling to maintain a desirable temperature level. The environmental elements include ambient air temperature, solar radiation levels, wind speed, and wind direction. These design parameters also include shape factors, surface transparency, orientation, thermal properties of materials, and distance with surrounding buildings. The different building typologies have been identified and categorized as the most common in Saudi Arabia. There are apartments with balconies, apartments without balconies, villas, and traditional houses. The villas and apartments are considered new buildings where no more than 30 years has passed since their construction. Not all new buildings comply with the Saudi Building Code, where energy efficiency policies are enforced to reduce energy requirements such as insulation and double-glazed windows. Apartment buildings form blocks of 4 different buildings condensed together. Some have balconies and some don't. Villas can either be standalone buildings or twin villas, with either a wall covering the perimeter or 2 villas stuck together. The traditional houses are older than the apartments and villas and do not conform with the building standards. The units are packed closely together and usually exist in slum areas. Generally, the buildings in Saudi Arabia have not been designed with passive features or energy efficiency in mind. Therefore, thermal comfort and general comfort is not considered in the design phase. The link between achieving thermal comfort and consuming huge amounts of energy in the Gulf region is justifiable considering the harsh climatic conditions. In Saudi Arabia, the buildings are the highest contributors of electricity consumption. Following the recommendations of the World Health Organization, the Saudi government imposed partial lockdown and restriction on individuals' movements in an attempt to control the spread of the pandemic. Movement was fully restricted between 6 to 3 a.m. Roads have been blocked and checkpoints installed in most areas. Leaving the house was only allowed for essential errands, and workplace and school attendance has been suspended. Commercial activity and retail, wholesale shops have been closed, as well as the suspension of all domestic and international flights. Accordingly, the time spent inside homes has increased drastically between this period. First of all, I'd like to highlight that this study is still ongoing. It aims to evaluate the possible influence of the home's architectural features on the occupants' thermal comfort during the lockdown period of Saudi Arabia. Also to assess the general and indoor comfort based on architectural features while comparing the comfort levels before and after the pandemic. Also assessing health issues and general comfort in relation to building parameters. Issues such as building layout, orientation, and design have been underlined. In the case of future pandemics, it is necessary for occupants to feel comfortable in their homes to minimize the effects of the lockdown on a physical and psychological level, therefore reducing the impact of illnesses associated with poor indoor environment. The questionnaire, which consisted of 28 questions, was designed to explore the influence of lockdown on thermal comfort, among other aspects related to comfort inside buildings, like visual and acoustic comfort. 105,000 participants have been included in the study in May 2020 during the peak of restrictions. The topics were investigated, including participants' background, indoor comfort, and architecture analysis, as well as satisfaction rates. The participants' background covered gender, age, location, based on climate type of dwelling they lived in, as well as psychological issues and well-being. Indoor comfort explored availability of natural ventilation, daylight, outdoor spaces, views and orientation of spaces inside the building, as well as further architectural analysis before and after the lockdown. Satisfaction levels were inquired to assess awareness of overall contentness of availability of architectural elements, such as balconies, courtyards, or top roofs, that help in achieving comfort, and whether the respondents had enough of those elements in their homes to reduce the symptoms of the lockdown. As for the sampling method, a probability method, namely simply random, was applied in the study, as people have equal chances to participate in the questionnaire. The preliminary results of the effects of openings in the areas of the house where most time is spent only show slight changes before and after the lockdown. Almost half of the people have windows for openings in the areas they usually spend their time. A combined 25% have either a balcony or glazing in the areas they spend most of their time. Interestingly, around 25% they have no open spaces at all. As openings are a major indicator of thermal comfort levels in terms of ventilation daylight, while windows, glazing, and balconies offer daylight, only windows and balconies are able to provide fresh ventilated air and therefore enhance indoor thermal comfort. The architectural design elements within a building permit adequate interior air velocity, type and location of window, balcony configuration, and interior layout of spaces. In regards to the views of the rooms, most people said the rooms overlook the streets, followed by views overlooking courtyard and neighbor. Only 10% have views overlooking a garden, and 7.5% said they have no views at all. Visual connection is in part related to comfort levels and has been found to be linked to stress reduction and overall health and well-being. Natural ventilation source, 70% of the respondents said there is a natural ventilation available, and a surprising 30% said they don't have a source of natural ventilation. The majority of the natural ventilation is available through windows and a small percentage through balconies. Ventilation is an essential aspect of indoor comfort and is related to air circulation and the removal of accumulating dust and pollutants. Proper air circulation indoors reduces the requirement for cooling if the openings are placed correctly to achieve maximum cross-ventilation. The requirement for air filters is important in preventing particles loaded with the coronavirus and spreading around enclosed areas. Considering the high temperatures in Saudi Arabia during the period of the study, people were more likely to have used air conditioning for cooling instead of naturally ventilated air to achieve the desired air temperatures. In regards to outdoor spaces and availability of daylight, when investigating the awareness of the building dwellers on the importance of this, it seems that most of the survey respondents completely agree with the significance of these factors. This shows the high awareness of the surveyed residential dwellers and the requirement of accessible outdoor spaces. The availability of outdoor space is required, especially during lockdown, to compensate for the closure of public outdoor spaces such as parks, gyms, and swimming pools. The provision of outdoor space is necessary to allow the home dwellers the space for physical movement and comfort. Around 30% of the respondents were either completely dissatisfied or dissatisfied with the availability of natural ventilation. Only 33% have access to outdoor areas. And this percentage correlates with the people who do not have access to outdoor spaces, to emphasize the requirement for balconies and courtyards and gardens to achieve optimum satisfaction. There's an overall high dissatisfaction rate with the architectural features and current layout of the residential buildings, which require immediate attention and improvement. Addressing this issue will have long-term benefits such as psychological well-being of the residents, as well as reducing overall energy requirements. The next steps will be applied to further investigate the influence of a building's architectural features on thermal comfort through an analysis statistical approach, taking further interviews, a simulation study to quantify the effect of every feature of the statistical test, and repeating the study in another location. The conclusion from the research will provide guidelines and recommendations for different building typology design requirements. It will enable us to order the importance of each architectural feature and therefore prioritize the order of impact of thermal comfort. These guidelines will provide a basis for future pandemics, as the future is uncertain and based on history could repeat itself. Thank you.
Thank you, Nora. Very succinct presentation. I'm keeping to time. That's very good. I can see that Teresa has arrived in the room. Teresa, we didn't get a chance to talk to you at the beginning, but I think your name's attached to
Dr. Abdullah.
I'm here, yeah. So I want to share my screen.
Yes, now you can start.
Okay. Since I have two in a row, okay. This is the first one. Okay, on the full screen here. Okay, thank you. So, good afternoon, everyone. I hope you can see my presentation and hear me okay. My name is Teresa Cuerdo. I'm a PhD architect and I belong to the Spanish National Research Council. My main research topics are habitability and comfort in buildings, social housing, and energy efficiency. I will present two similar works in a row. This first presentation offers the results obtained by a survey carried out during the Mexican COVID-19 lockdown. This study was based on the original one, the Spanish, that I will present next. This study was developed with the Mexican universities, UNAM and La Salle. This current presentation is about experience indoor comfort in general and thermal in particular, and energy expended in confinement. This project was on confinement, housing, and habitability. It was based as the original one on a participatory mix of methods study, exploratory, that combined quantitative and qualitative approaches using a questionnaire, photos, and written testimonials. Was online with a national scope. The aim was to analyze the reality of lockdown through the binomial household dwelling. Some specific objectives were to put in value different habitats, urban, intermediate, and rural, including the immediate built environment and different urban areas and neighborhoods. To know living aspects and home features such as habit change, occupation use, habitability, energy, comfort, and satisfaction in general with domestic space. To approach to resilience offered by housing through similar future situations, generate specific knowledge, citizen science, and promote and contribute to action strategies. The total samplings for this study was more than 1,000 valid response for the questionnaire, and for the qualitative part, we obtained 600 response with their respective photos, tags, and testimonies. Next, some results on indoor environmental quality and energy expenses are to be shown. Regarding the open spaces in the home, only the 16% did not have such spaces. On indoor environmental quality, 3 aspects were required: air quality, general lighting, and acoustics insulation. Whilst the 2 first were considered as good or very good, the noise insulation was not enough for more than a third. As the main altered habits or tasks in the home by COVID-19, there were telework, social relations, rest, sport, outdoor activities, home chores, eating, caring, and personal hygiene. Taking into account the special adaptation in the homes, participants highlighted telework again, clothes change after going out, for instance, space for storage, family leisure, isolation of potential COVID-infected people, and isolation of people in risk or active healthcare professionals. Regarding the domestic equipment, a list of appliances and devices was given to see the incidence of use during lockdown regarding the regular use. The most used in this period were the digital ones, PCs and mobile devices, tablets and mobile phones. Those that have not altered their use were freezer, washing machines, oven and stoves, vacuum cleaners or dryers. No equipment decreased its use during confinement. Related to domestic hot water, for more than a quarter of respondents, the use of energy was increased with the energy consumption associated. The most of them did not change their hot water use. On thermal comfort and HVAC systems, the availability of the usage patterns of heating and cooling systems are expressed in this slide. The most of the homes surveyed did not have such devices. Concerning the heating ones, their use were almost null during confinement. Cooling use were also low during the lockdown. Sorry. Regarding the comfort perception, as indicated in ISO 7730 regulation, more than a half were not in comfort during the lockdown. According to change expected in energy bills, they would be relevant for 3/4 of the homes. In terms of household strategies to save energy, it stands out that almost a quarter of them did not carry out any strategy. The most used was turning off lights when not used for more than a half. So finally, we can release some ideas or conclusions. The confinement was an experiment, a measure, need for the common good, supposed an increasing of energy expenditure for all. All households had to increase their consumption of energy somehow, wherever their situation, but the response on comfort gave information about thermal environmental conditions in the homes, and thus on the quality of housing and the need of energy to reach comfort. HVAC systems are not common, and it's difficult to reach comfort for the most of the homes. awareness on energy saving and strategies to shorten energy consumption were in part missing, maybe when more needed. Despite the sampling of this study is biased by their nature, that implies somehow a certain quality of life, internet connection, digital resources, the energy expenditure reveals that contingency plans and strategies are needed to support vulnerable families. So that's all from the Mexican experience. Let's see now the original one from Spain. Sorry, 1 second. It's okay, the screening, I think. Okay. And now some reflections are offered on use patterns, energy consumption, and comfort in the homes during the Spanish general confinement. Some information on the project the project structure and the data collection, and even conclusions could result similar to the previous one. The information given comes from an original project developed by the Spanish National Research Council. COVID was a project on confinement, housing, and habitability. It was about to finish. It's about to finish by the end of the present year, and it's based, as we see, on a participatory mix and method study, exploratory, combining quantitative and qualitative approaches using questionnaires, photos, and written testimonials online, and also a national scope. The aim, again, is to analyze the reality of lockdown through household and dwellings. So, as no repeating the same, we pass to the next. The total sampling for the study was 1,800 surveys for the questionnaire, and for the qualitative part, we obtained almost 800 responses with their respective photos, tags, and testimonies. Next are presented some results obtained on personal behaviors, associated energy consumption, and perceived comfort during this period. About time dedication to daily activities, these graphics show different tasks ranked from 1 to 5, being 1 less dedication and 5 more time dedication. Home care to dependents and children was perceived as the activity with less dedication, followed by sports and family leisure, rest, home chores, and teleworking as the task with more time dedication. Related to domestic hot water, for more than a third of respondents, the usage of this service was increased with the energy consumption associated. Regarding the domestic equipment, a list of appliances and devices was given to see the incidence of use during lockdown respecting the regular use. The most used in this period have been those related to cooking activities and technology, PCs and mobile devices, followed by the oven, stoves, and dishwasher. Those that have not altered their use were freezer, dryer, food processor, vacuum cleaner, or washing machine. No equipment decreased its use during confinement. On thermal comfort and HVAC systems, the availability on the usage pattern or of heating, cooling systems are expressed in this slide. Concerning the heating ones, the most were individual systems, even portable, which could explain the relative low use of them, only when really necessary. Cooling for almost a half of housing was not available, being a third of them individual equipments, and their use were practically null during the lockdown. As we know, the lockdown were during the spring, so the incidence of those systems could be relative. Regarding the comfort perception, as expressed in ISO 7730 standard regulation, the 36.2% of households were not in comfort during the lockdown. As to household incomes for energy supplies, we found that the limit percentage established in 10%, which some literacy takes as energy poverty limit, is overcome by a quarter of the sampling for regular situations pre-COVID. In the context of lockdown, almost 30% of people who already received energy bills related to this period reported overcoming this value. For those households that had not yet received the bills, changes were expected for almost the half. In terms of household strategies to save energy, it's remarkable that almost a third of them did not carry out any strategy. The most used were those related to lights, shorten showers, and turn off the HVAC equipment were not in use. It's also highlighted that in 85.6% of housing, there were no systems to produce renewable energy. So finally, as we saw before, we can release some ideas or conclusions very similar to the Mexican experience. The confinement was, again, an experiment, a measure for the common good, but an increase of energy expenditure for all the situations, all the housings. The response of comfort gave information about thermal environmental conditions in the homes and thus on the quality of housing and the need of energy to reach comfort. Renewable energy systems were not available in the homes, maybe because they were mandatory from 2006, where almost all Spanish housing were already built. Awareness on energy saving and strategies to shorten energy consumption were in part missing, maybe when were more needed. Despite the sampling of these studies biased and again by the nature that implies somehow a certain quality of life, the energy expenditure for a quarter, almost a third in confinement, reveals that people spend a lot of money on energy supplies, even in regular situations. And that's all. Thank you so much for your attention.
Thank you. Thank you, Teresa.
You're welcome.
Now we can, I think our last presenter in this session.
That was the last one, Abdullah, because Teresa had two presentations, so she just ran from one straight into the second.
Okay. So another also, Teresa has two second, is it? Teresa, same author has a second paper.
Yes.
Okay.
Teresa can confirm, I guess, if there's nothing else for her to present.
Thank you. You can start your second presentation.
It was my two presentations,
yes.
So I think I ran a lot.
Yeah,
is it possible or?
You finished early, yes.
Yeah, the two ones.
Okay.
It's fine. It gives us more chance for questions, I think, therefore.
Yes, now we can make a question and answering session for all of you. Yes. So if you have any question.
I would suggest, Teresa, if you could stop sharing your screen, then we can see.
Yeah, I'm trying.
Okay.
I have to. Okay. So sorry, but I have to come back to the Zoom, and it's always a problem.
Well, I think we can carry on anyway.
Oh.
Well, we could ask some questions. Abdullah, do you want me to start with this, or do you want to start on this?
No, it's okay.
Okay. Right. Well, I can see. I think there are some questions in the Q&A section and some comments in the chat. I think if I could ask the attendees if they have anything, just put it in both. We'll start with the chat and then move to the Q&A. So in the chat, the first question is from Mishan to Professor Gupta. What is the reliability of comfort surveys, thermal sensation and preference, without knowing the real indoor temperature? How do you extend further explanation of it without knowing the temperature or other physical environment factors in the pattern?
Yes, Mishan, that's a good question. And there were limitations to do measurements of temperatures in homes during the lockdown, because obviously you couldn't enter homes and do the conventional way of measuring. However, we did gather information on the physical aspects of the dwelling. Some of these homes will also continue through monitoring as part of hopefully the site project, where we will be measuring temperature over different seasons. So we hope that that bit of information will be captured as well. But during the lockdown, it's pretty difficult to go into homes and take physical measurements. But it's I take on board that that's obviously a limitation of such studies.
Thank you.
Thank you, Rajat. There is a question also from Mishan to Teresa, which was, have you included the information about window opening patterns or behaviors, natural ventilation, to be safe from COVID? Is it connected with energy saving potential also?
Yes, we include a question about comparing ventilation habits pre-COVID and during the COVID lockdown. Yeah, but it sadly not shown in the presentation.
Okay. I'll go over to the question and answers. Sue Rofe, the question for Nora, which is, we've concluded that opening windows are an essential feature of resilient buildings. What do you think of the idea that it should be required in building regulations? That is, to have natural ventilation as a human right.
In terms of policies, they are existent in the Middle East, but it's also a matter of implementing these policies and just having someone to go around from the municipality and ensure that people or construction is complying with these regulations as well. But due to like the government's need for rapid urbanization and the buildings that keep multiplying every year, sadly, there's like no one to conform with these regulations.
Okay. And Sue also asked a question of Teresa, which is, do you think that homes in future should have at least one bedroom for safely nursing sick COVID patients, and that those rooms, they should be able to affordably protect both the carers and the patients from high viral load by having usable opening windows?
Well, it's a very difficult question, because it's for vulnerable families is difficult to have enough rooms for them. So even for people that live with nursing patients, but the isolation of these people, it has to be difficult in this situation, because it was abrupt and disrupting event. But I hope the housing design change after this experience, and we take good note about it.
And I think there was a follow-on question, was, is fuel poverty a large problem in Spain?
Yes, sadly, yes. And more hidden energy poverty or fuel poverty, yes. It's not as it's not similar to the South problem in terms of, for instance, coal usage or something like that. But yes, it's present. Yeah.
And I can see one more question for you, Teresa. Were the same questions including both studies, and how were the participants selected?
Yes, the questions were almost the same, except for those nuances that comes from the cultural heritage, or for instance, words used in Mexico and Spain. But yes, the main ones are the same. And the participant selection was through online websites, and trying to spread the questionnaire. We use also use web scraping to obtain emails from associations, neighborhood associations, and councils, contacts, and so on. Mm-hmm.
Okay. Could I ask a question? And I know there are still one or two open ones on the screen, but a couple of the presentations gave information about the increase in residential energy consumption. But is there any information about any consequent reduction in commercial or public building energy consumption? For instance, by looking at the overall statistics for the country or the area, could we see a matched reduction in energy consumption in any of the other buildings? I think both Rajat and perhaps, was it Nora, mentioned that?
Yeah, no, you're right. There's bound to be some reduction in the commercial or institutional buildings, but we have to be mindful that those buildings cannot be shut down. Some amount of background energy usage is happening all the time, and I suspect that it's not well controlled. So homes or buildings must be, offices must be cooled or heated in some locations, even if occupants are not in, because they have to maintain some level of indoor environment. But the issue really is that as more people work from home and there's homeschooling, will that rise in residential electricity use surpass the slight reduction we see in commercial buildings? I think there needs to be much longer term studies to look at that, I think. And the second point I would say is that from these studies, there is another learning that what methods or what measures that we have adopted during lockdown can be taken forward as towards a battle for net zero. Are there some things like home working or hybrid working that will help us in reducing our transport footprint and will help with net zero? So there are some learnings in the way societal trends have changed over the last couple of years, I think.
Or it may be the opposite, Rajat, that people working from home have less efficient systems than if they were all in one office block.
Yeah,
perhaps, yeah.
True.
I can see a question from Sue. I know you answered a couple already, but perhaps I don't know if Teresa or Nora have any response to that question about whether energy consumption would go up as a result of the energy consumption go down in non-domestic buildings. Or perhaps not. Maybe no more comments on that. Teresa, do you have any comments? No. Okay. So Sue, I think, also asked, do you think increased building integrated solar systems with batteries on homes might be an answer to the home working pandemic?
Potentially, yes. We've done a lot of monitoring studies in UK with solar and batteries. Haven't seen the results that were expected, because it's not just batteries, it also depends on the underlying demand of electricity, what's the generation from the PVs, and also I think we have to look at second life batteries. We don't want to have virgin batteries in every home, because that will cause environmental impact of a different scale and level. So I think utilization of maybe car batteries or other ways, or reusing them batteries certainly should be encouraged. So yes, in theory, obviously it's a good thing, but in practice, we have to also see how this is implemented and that we don't cause another problem and solve one, I think. So we have to be careful.
Thank you. I'll hand over to Abdullah. I don't know, Abdullah, if you have any points.
No, it's okay. I'm enjoying the answers for that.
I can see actually there were a couple of questions that were already answered by Rajat during the session.
Yes.
Which was one on thermal mass and the other ways in which agencies might work together to identify vulnerable households. So if anybody wants to read the answers to those, they're already available in the question and answer section. But, would anybody else like to ask any further questions? Otherwise, we're going to finish quite early in this session. No. Okay. I do have the odd question I was noting down. I could just ask, which was to all of the presenters who used participants during the COVID pandemic. Did they find it easier to recruit participants because they had nothing else to do but answer the questionnaires? Because I think there were some very significant numbers of people involved in these studies. And normally it's quite difficult to get participants to agree to take part. So I just wondered if any of you had a comment on how easy it had been or how difficult to get participation during COVID. I'll ask Rajat to start with because he's first on my screen.
Yeah, no, I think it's a really good question. You know, historically, online surveys are not great because they don't have good returns. But I think what happened in COVID was there was this explosion of digital savviness amongst people, and everybody was online. So the fact that, you know, normally you would have a limitation that if you do an online survey, you exclude people who are not digitally savvy. I think in this case, you know, that risk is minimized because most of the people are. We felt that in the beginning of the lockdown, people were more enthusiastic to participate in these studies. If we were to do it again, I think our response rate will be much lower because there's been survey fatigue. You know, people have been online too much. So adding another survey may not lead to. So I wouldn't say that this is the way forward. I think that time it was appropriate because, you know, there was this increased, you know, online presence. So yes, that definitely helped. We also found that resident associations were very helpful in sending out our survey link to their, you know, housing societies and their residents, which normally is very difficult to do. So yes, I think that has been a benefit. I don't think we could assume this will continue, you know, for a long time because there's been a bit of survey fatigue also, I think.
Okay. Teresa, do you have any comments on that?
No, no more that are grouped up because it was very difficult to reach vulnerable people because of the reasons, because people that did not have digital resources or a good internet connection did not respond. So it was so difficult to obtain information from this segment of people. So it was sad, or it was a shame, but we did not have any more to do in such aspect.
Okay, thank you. Nora, I don't know if you can still hear me, if you have any comment on your work.
Yeah, actually, we didn't face any problems. As was mentioned, people mostly were online, and the questionnaire was posted on Twitter with one of my colleagues who has more than 30,000 followers.
Ah, right.
So yeah, we aim to increase the response rate, and we translated it into Arabic. And basically, the questions were easy enough to answer.
Yeah, but still 1,500 participants is a good number to get that.
Yeah.
Okay. I think unless there are any other questions or any other comments, we could probably close the session. It is a little early, but maybe give you a chance for a refreshment break. There is a keynote plenary coming up in about 30 minutes or just under. From Rajan Rawal on what's it? The whole something besides the parts, energy performance of cities, which sounds an intriguing title. And then, of course, the 2 final sessions at the end of the day. But if there are no other comments or questions, I'll say thank you very much to all the participants, keeping to time, indeed finishing ahead of time, which meant there was no need for anybody to jump in and say how many minutes left there were, and hope that you enjoy the rest of the conference. Okay.
Thank you so much.
Thank you so much.